Hello and welcome. My name is Rick Forlano and I'm the Executive Director of Arthritis and Osteoporosis WA. With me today is Professor Richard Prince, a consultant endocrinologist. The topic of today's presentation is COVID-19 and osteoporosis. This presentation will consist of two parts. Firstly, Professor Prince will provide us with an overview. This will then be followed by a question and answer session. I will now hand over to Professor Richard Prince to present part one of this series. Thank you.
Thank you to the Foundation and yourself for this important presentation on bone disease at the time of COVID-19 and the future. As you know, WA is done pretty well in avoiding the worst of this pandemic. This is a perfect time for our members to review how they are looking after their health needs in general, not just COVID-19 in particular. So that musculoskeletal in general and osteoporosis in particular are chronic bone diseases, very similar to cardiovascular disease. In fact, people with bone and musculoskeletal disease are at increased risk of cardiovascular disease and vice versa. So this is a great time to review the situation and perhaps talk to your GP now they're back online, either by telehealth or face-to-face. Now, fractures, which is a clinical event we're avoiding, are due to, first of all, excessive force in falling and poor resistance of our skeletons, especially as we age. Although there are specific diseases that increase osteoporosis risks such as the use of prednisone. So the important thing here is to practice balancing and practice keeping your bone strong by using bone bending exercises. That is walking, because your body weight bends your legs, and some sort of resistance exercise for your upper limbs, so they bend a bit. Each time they bend, they get a bit stronger, and I'll show you why. Now, on the other side, bone mass, the first thing to do is to make sure you've got lots of stuff the bone needs. Calcium is a particular problem in our diet. We'll talk a bit about that. But then there's the two really important things: medications to stop bone loss, and there's several of those, but also medications to increase bone formation, which may not be being used as much as possible. So what's COVID-19 got to do with these things? Well, what I want to do is just to describe some basic things you need to understand about your bone, and then you'll be able to work out how to deal with the problems in the face of the pandemic. Now, this is a fracture. As you can see, your bones are that shape, but at least 10% of us as we get older have got these, and we might not know about it. But if you do have it, that's osteoporosis. You can get it tested on a DEXA machine these days, at the same time as bone density. So this is an important thing to think about at the time of your DEXA test. This is what is going on underneath in the microscope. So this is normal bone, nice honeycomb, and this is what osteoporosis is. It's got holes, the bones, and you can see it's being eaten out here by osteoclasts. Now, this is the important news. You can stop this and you can reverse it. You can make your skeleton younger. You get a new skeleton every 10 years. And if you play your cards right, it actually builds more bone than you had at the beginning of the 10 years. If you ignore it, it tends to just do its own thing and get thinner. Okay, how does it do it? Well, this is a bit of a complicated slide, but this is the important bit. These are the cells that make new bone, and these are the cells that are dissolving, the osteoclasts. Two sorts of treatments work on one on osteoclasts, one on osteoblasts, and they talk to each other, and they're continually remodeling your skeleton to get rid of old bone. That's why your bone's only 10 years old. So we'll be talking about treatments that affect these two. Now, this is another X-ray slide. This shows that the first stuff that's laid down by these osteoblasts is actually protein. It's called osteoid. And if you don't have enough calcium and D, it doesn't calcify. And that is good old osteomalacia, but it's still occurring in us, in our modern society, because our D level, vitamin D levels are often a bit low because we avoid the sun to stop getting skin cancer. So we need to think about how to deal with that, and tablets are the way to go if necessary. This is just to remind you how we do bone density. You're here, that's a person there with the backbone here. The X-rays, low radiation, come up here. The more bone there is, the fewer of these photons get through. So we can work out how much bone mass there is. Now, if we look at this, again, a bit complicated, but this is bone density here in grams per square centimeter, and this is age. So here we are, aged 20, say, and this is as good as it gets. But you'll see that some have more bone density than others. So that's determined to a large extent by our genetics. We inherit this. Then it's, I'm afraid, a downhill slope, because the osteoclasts eat faster than the osteoblasts. The osteoblasts are getting tired. So if you start here, and as you get into your 70s, these are the people with fractures. So you can see how bone density can help tell you that you're at risk of thin bones and fracture before it's actually happened. Okay, now, it's not only bone density, it's age. For the same bone density, the older you are, the more likely you are to fracture. This is the 6-year risk of fracture. I mean, somebody up here with osteoporosis and aged 81 has got a 40% chance of a fracture in the next 6 years. At the same bone density, a younger person at 55 has only got around about a 10% chance. So what we need to do is, we can't stop you getting older, but you can stop your bones getting thinner. Indeed, you can make them thicker so that your risks are lower. The International Osteoporosis Foundation has produced this information to deal with the COVID-19 problem. And so this is obviously a huge international issue for all. So what they pointed out is preventing those falls, as we've discussed, by maintaining balance. Is it really important? And they obviously, you should look at your home to make sure there's nothing to trip over. In my business as a doctor, I encounter patients who've fallen over their dog. So you have to be careful. Mats are a problem. I don't know about you, but I put some grab rails in my bathroom to stop me slipping. So think about reducing your risks of falls. This has been a great concern for doctors, because it turns out patients have been nice enough not to turn up because they think the doctors are overwhelmed with COVID-19. Well, that actually is not true. Many GPs have had much less work because we haven't been looking after our chronic disease things, health status like osteoporosis. It's really important to get your prescriptions and get them filled. It's true that we've been told to stay at home, but there's, you can visit your doctor online now. The payments are being made for it. So your doctor is really keen to make sure you're doing the okay thing about your chronic health problems, especially if COVID is only going to be around for a year or so. This is just general issues that we've all been told about, but is still relevant to osteoporosis. Osteoporosis medications. They are really effective in reducing fractures, but it's essential that you get prescriptions filled and then take them. For example, the way I try and remember is keep them next to my toothbrush. So that's a way of dealing with a problem of remembering. The books tell us that maybe 50 to 60% of people do not take their pills on a regular basis. Well, for bone disease, that means they won't work. Now, injections. Now, this is really important. There's one that's given every couple of years into the bloodstream, zoledronic acid. That's done in a clinic or hospital situation. But the other that is done in the GP practice more, or you can do yourself, is called denosumab or Prolia every 6 months. Now, this is the one that if you miss out after at the 6 month mark, can cause a big problem because your bones get thin very quickly. So this is the one that we are most concerned about for the people on it to get it regular. This shows the fracture rates here. So that's 25% of the population, that's 0. So this placebo, and before and after, the rates were about 10%. You know, it's pretty high. The people who were taking the Prolia down here had a rate down around 2%. But as soon as they stopped, they leapt up to this 10% mark. So this is why we're very worried about people missing out on their Prolia prescriptions. In the package insert, it shows you how to do it yourself. So at the very least, you've got to get the prescription filled by a doctor and the pharmacist. And then some of you, if you feel up to it, could even inject it yourself, which would then reduce somewhat the problem of getting in contact with health professionals. So I'll stop at this point and hand you back to Rick to discuss the questions that you've raised, which are really interesting and important. Thank you.
Thank you, Professor Prince, for a most informative overview on COVID-19 and osteoporosis. I'm sure we've all learned quite a bit from that. Once again, thank you for your time that you give freely to this organisation.